Medicare doesn't make any sense. So remember, here at Healthcare Solutions Direct, our goal is to make this simple as 1, 2, 3. We're going to talk right now about Medicare Part B medical coverage and what that doesn't cover. It's really important that you understand what Part A and Part B do not cover. So if you haven't watched the Part A video on what Medicare doesn't cover, I really encourage you to watch that video. But let's jump into Medicare Part B. Medicare Part B, as we've discussed earlier, is the medical side of Medicare. So this is what most people will use Medicare for, is the Medicare Part B. So Medicare is different than group, individual, or Medicare Advantage Part C plans, which include all their healthcare services in an all-in-one plan. Remember, Medicare Part B typically covers doctor visits that include primary and specialists. It includes preventative care, outpatient surgeries and procedures, durable medical equipment. It includes chemotherapy and even ambulance rides. So let's look at right now what some of the services are that currently, as of July 2021, Medicare Part B will not cover unless it's determined that it is medically necessary. So here is the big one. It's dental care. Medicare will not cover any preventative, basic, or major dental services. This is probably the biggest concern for those that are going on to Medicare, which would fall under Part B of Medicare. So things that many individuals may have been accustomed to, like preventative routine checkups, cleanings, and x-rays, will not be covered by Medicare Part B. Basic dental services like fillings, tooth extractions, root canals will also not be covered. Major dental services like crowns, bridges, and tooth implants will also not be covered. So if you're needing coverage for dental services when you are Medicare eligible, there's typically 2 ways that an individual can get that coverage. So there are many Medicare Advantage plans that will include some sort of dental coverage for the member. The other option available is to purchase a standalone dental plan. Many standalone plans will also include dental, vision, and hearing coverage, and they're referred to as DVH plans for around $30 a month. So if you're needing help with either of those 2 things, please reach out to us here at Healthcare Solutions Direct so we can kind of point you in that right direction. The other big thing that is not covered under Part B, which is a big concern, which also kind of falls under dental, is dentures. Medicare will not cover dentures, which would fall, as I mentioned, under Part B. So this is an area that can be very costly because dentures can run upwards of $3,000, which is very expensive. So if someone is needing coverage for dentures when they're Medicare eligible, here are again 2 typical ways that we've talked about that the individual can get that. So there are many Medicare Advantage plans that will include some sort of coverage for dentures for that member in the plan. The other option that's available is to purchase a standalone dental plan. Many of the dental plans will include dentures in their dental coverage along with vision and hearing. We talked about this a little bit earlier. They're referred to as DVH plans, which are around $30 a month. The other thing that Medicare will not cover under Part B is it will not cover eye exams, eyeglasses, and contact lenses. So Medicare will not cover your routine eye exams, eyeglasses, or contact lenses. The one exception to the rule is this, that Medicare will pay for 1 set of glasses or 1 set of contact lenses when someone has cataract surgery to remove cataracts. So we talked about cataract surgery in a previous video, so be sure to go ahead and look that up and watch that video on cataracts. It's got some really good information on there. If someone is needing coverage though for vision when they're Medicare eligible, again, there are these 2 ways that they can get it. There are Medicare Advantage plans that include some sort of coverage for vision for the member. The other option is to purchase a standalone vision plan that will cover routine eye exams, eyeglass, or contact lenses. And the good thing is that many of these standalone plans will also include dental, vision, and hearing coverage referred to as a DVH plan for around $30 a month. So the other thing that Medicare will not cover is they won't cover cosmetic surgery. So Medicare will not cover cosmetic surgery, which would typically fall under Part B unless it's medically necessary. So Medicare would consider something medically necessary if you were wondering, like breast reconstruction if someone had a mastectomy because of breast cancer. So there are some Medicare Advantage plans in certain areas that will offer additional benefits that could be used for certain elective cosmetic surgeries. If you're needing some elective cosmetic surgeries, please reach out to us here at Healthcare Solutions Direct so we can look at those Medicare Advantage plans to see if any of them in your area offer this additional benefit. Another big thing that Medicare Part B does not cover is it does not cover hearing aids and the exams for fitting them. So they're not going to cover that, which would fall under Part B. Medicare will only cover diagnostic hearing and balance exams. If someone's doctor felt it was medically necessary to see if the treatment would be needed for the condition, Medicare will just cover the hearing and the balance exam. They won't cover hearing aids or the exams for fitting them. Now this can be a big problem because the cost for hearing aids can be very expensive, and they're anywhere from about $1,000 to almost $6,000 for hearing aids. So again, if someone's needing coverage for hearing aids when they're Medicare eligible, this would fall under those two categories that we talked about previously. Many Medicare Advantage plans will include some sort of coverage for hearing aids for that member in the plan. The other option available is to purchase a standalone hearing plan that will cover hearing aids and the exams for fitting them. Many of these standalone plans will also include dental, vision, and hearing coverage, which we refer to as DVH plans, dental, vision, and hearing plans, for around $30 a month. So if that's something that you're needing help with, please reach out to us here at Healthcare Solution Direct so we can kind of point you in the right direction. Here is a topic that is very misunderstood: routine foot care. Medicare will not cover routine foot care, which could be classified as, you get it, pedicures. A lot of people have tried getting their pedicures actually covered by Medicare, and unfortunately, Medicare will not cover pedicures. They also will not cover toenail clippings or the removal of corns and calluses, and this would all fall under typically Part B. So if an individual is needing to see a podiatrist for treatment related to, say, diabetes or nerve damage with their feet, that would be something that Medicare Part B would consider medically necessary. So Medicare would also consider things like foot injuries, bunions, heel spurs, and hammer toe as medically necessary. So now you have a little bit better understanding of exactly what Medicare means when they say they do not cover routine foot care. The other thing that Medicare will not cover is they will not cover massage therapy. So that would usually typically fall under Part B. It'd be very hard to find this as an additional benefit also offered by a Medicare Advantage plan. Most individuals that need massage therapy will go to a massage therapist. Remember, Medicare doesn't make any sense. So if you have any questions about what Part A or Part B does not cover, please reach out to us here at Healthcare Solution Direct so you can talk to one of our client experience group members that will actually go over exactly what questions you have and point you in the right direction. We look forward to hearing from you.